Hello and welcome to my presentation on being pregnant while Black, a look at factors that impact high Black maternal mortality and morbidity rates. So what does it mean to be pregnant while Black? Being pregnant while Black means facing implicit or explicit bias and racism that affects the standard of care that Black women receive. It means going unheard, being ignored, or being gaslit about their concerns. Black women in America are 3 times more likely to die from pregnancy than if they were white. So in this video clip, we're going to see somewhat of a representation of this.
Clearly a tear. Good job, Mom. I hate doing stitches after midnight, so thank you. Here you go. Got a name picked out?
Not one that we both agreed on.
I feel something.
Yeah, so cute.
Excuse me?
Epidural should last another few hours. Is it tingling?
No, more like a pressure.
Well, sometimes the hormones mess with your head a little.
No, I'm telling you, something's wrong.
Just try to relax.
Greg,
I'm taking a photo. His feet are so
please,
cute.
please.
Hey, doctor, there's a lot of blood.
So this clip was a representation of everything I just said, but mainly I want to point out the fact that she wasn't being heard. Yes, it is a high stress situation, but her concerns weren't being regarded seriously. And towards the end, she had to advocate, but beyond trying to advocate for herself, she had to reach out to her partner to hopefully advocate on her behalf. So that touches on important themes that I'm going to cover in this recording. Why does it matter? So Black women tend to have the higher percentage or the higher proportion of deaths per live births in the country. So 2011 to 2016, it was 42.4 deaths per 100,000 live births. And then 2022, 49.5, 2023, 50.3. And then in 2024, although this may not have been a national average, it was reported as 69.9% or 69.9 deaths. And of course, these are averages for the country. In certain states, in certain areas, depending on state policies, depending on hospitals and the type of hospitals and whether they're equipped or not, it can be higher. So compared to other races, which of course these aren't all the ethnicities or races, but for whites, it was 14.5 out of 100,000 live births. Hispanics, it was 12.4, and Asians, it was 10.7 in 2023. And socioeconomic status and education level does not make a difference. So as you see here, I have pictured Serena Williams, Beyonce, and Allison Felix, who, although not dead, they each experienced their own difficult birth stories and complications that it felt like their race impacted the way that they were treated or the fact that certain things were not caught in time. And of course, they're famous celebrities. So their socioeconomic status does not necessarily inherently prevent them from being able to receive the best absolute care. And on the left-hand side, we have pictured Tori Bowie, an Olympian sprinter who unfortunately did die from complications, and another Dr. Janelle Green-Smith, who was a certified midwife, who advocated specifically about this topic and wanted to reduce the overall maternal mortality rates for Black women. And unfortunately, she died after giving birth to her first child. So this is a widespread problem. It may not be widely televised, but it is something that is happening every single day to Black women in America. So factors that influence Black maternal outcomes, we have prenatal factors like contraceptives and access to either better contraceptives like IUDs or, just more effective contraceptives, sexual education, prenatal care, and once again, access, PCOS, obesity, pre-existing conditions, infertility, and with infertility, there's actually very small sample of Black eggs and Black sperm that Black people are able to choose from that they can perhaps use to get pregnant with a baby of their same race. And that is also a concern and an issue that is out there. We also have miscarriages, diabetes, chronic hypertension, and state policies and the ways that states enact policies can severely impact and affect Black women negatively by reducing the level of care. And then we have perinatal diseases, induced labor and C-sections, eclampsia and preeclampsia. And then postnatally, stillbirths, preterm babies, low birth weight babies, which is a very, very large and bad problem within the Black community, postpartum depression, sudden infant death syndrome, and of course, the overarching issue above all of these factors is systemic racism and implicit bias. So racism and its effect on healthcare. So unfortunately, medical environments have racial stereotypes that they still believe and still propagate up until now. This in a study in 2016 found that medical students still believed that Black people had higher tolerances of pain, thicker skin, and less sensitive nerve endings, which of course is not true. But with those perceptions, that really affects the way that Black people are treated and cared for. Receiving less than adequate care is unfortunately a very common problem. Removing Black women from medical spaces systematically has also affected racism in healthcare because, for one, removing and undermining Black midwives in the early and mid 1900s also reduced the amount of representation in medicine and also just pushes out Black individuals from those spaces. We have the distrust of medical providers because of unfortunate history around sterilization, eugenics, and experimentation. Overall in the United States history, but especially in the 1900s with things and experiments like the Tuskegee syphilis experiments. And so there's an overall distrust of the medical and scientific communities by the Black community. And then, like I said, underrepresentation in medicine is also very common and unfortunate. And then racism and its effect on Black women. So we have the idea of self-fulfilling prophecies where, because, as I say later, culture, family, society expects a Black woman to act or to be a certain way, sometimes that is propagated in how they act. And so we might have the expectation that we're expected to be tough or able to carry all these burdens emotionally, mentally, and physically. And so we may not seek help in the time that we need to, or we may not choose to do things that would help our health for the sake of how it may appear to others, especially those in our cultures or families. And then with that, there's also the angry Black woman stereotype, which is very unfortunate because when a Black woman is advocating for herself or even just trying to be assertive, sometimes that is labeled as being aggressive. And because of that, they aren't receiving the care that they're supposed to. And we especially see that in social media depictions that occur in hospital settings where a woman is actively just trying to advocate for herself and explain what is going on, and they have security called on them, or they're being spoken down to or condescended by medical staff. Going unheard and ignored, which can, again, make it more difficult for them to want to speak up or want to seek help. And then stress, fear, and weathering. And weathering is a term that describes the idea that Black people as a whole are aging more because of the effects unconsciously and consciously of racism and the things that they face every single day and microaggressions that just age us both emotionally and physically. So there are diseases that are very prevalent in the Black community, such as anemia, sickle cell disease, and lupus, and these are all blood-related diseases. So Black women tend to have a higher prevalence of anemia and low hematocrit levels or blood cell count. And sickle cell disease is a group of red blood cell diseases that is predominant in people of African descent. Black infants born to mothers with SCD are at increased risk of morbidity during their first year. So complications like SCD and lupus actually add into the complications that Black women experience while they're giving birth and during pregnancy. And unfortunately, those with sickle cell disease also have to face and counteract the stigma of being drug seekers or considered drug seekers because they're asking for pain medication and they're not receiving adequate doses or in the adequate timing that they need. Lupus is a chronic autoimmune disease where the immune system attacks healthy tissues, causing inflammation and damage to joints, skin, kidneys, hearts, and lung. And lupus is most prevalent in Black women. And women with lupus are more likely to have complications during birth, such as increased risk for cesarean delivery, preeclampsia, and preterm labor. So complications such as eclampsia are popular among all women. It is a seizure disorder that occurs in pregnant women with preeclampsia, which is characterized by high blood pressure and often proteinuria, which is protein in the urine. Symptoms include high blood pressure, headaches, blurry vision, and convulsions. The presence of chronic hypertension in Black women, even before pregnancy, is very prevalent. We have 36.11 per 1,000. And so it is something that is very common in the Black community as well. And Black and white women did not differ in the prevalence of the 5 specific pregnancy complications, which aren't listed here, but did include eclampsia and other complications. They were 2 to 3 times more likely to die from these complications than white women. Induced labor and push for C-sections. So unfortunately, C-sections are pushed on Black women in a much higher rate and proportion than for other races. So in 2018 to 2020, it was 35.9% for Black women compared to 30.7% for white women. In 2020, it was 30.6% compared to 24.9% respectively. And in 2022 to 2024, it was 37% versus 31%. And there's a greater push for epidural and pitocin to quicken the process, and it's pushed more frequently on Black women. So it was suggested by Dr. Monique Rainford that it may be due to a lack of patience by delivering physicians and a lack of proper education to the women about the risks involved. And there's also this idea that the physicians aren't taking the time to educate them about the risk for future pregnancies, like the fact that after C-section, it's going to be much more dangerous to have a vaginal delivery because of uterine eruption. And it's very unfortunate that women aren't told these risks or complications. And in a further study that spoke to doulas of many races, they found that when a Black woman came forward with the idea of wanting a C-section, there was much less pushback because they didn't want to kind of inform her about her choices. And when she was more resistant to it, they pushed a lot more, which is, again, unfortunate. So social support, why is it important? Having social support is necessary for the sake of advocacy, both in the delivery room and prenatal and postnatal settings as well. And unfortunately, as I stated before, a Black woman speaking by herself isn't necessarily enough because she will go unheard most of the time. So having support from partners, family members, and friends is very necessary, not just in a sense of in the delivery space itself, but for relieving mental, emotional burdens and physical burdens as well, and helping the new mom navigate motherhood. And in an interesting study that talked to men of color that had, whose wives had preterm babies, they talked about their experiences, and they found that they were being kind of pushed out of the experience in like the prenatal and perinatal experience. So whether it was in terms of going to the OBGYN or being involved in like classes and things like that, they felt like they were actively being pushed out of those spaces. They also requested and wanted that they would be provided with more education. So brochures, pamphlets, and like active participation, again, with their wives or with their partners that help them to understand what was going on. And they also wanted to have more support groups for men and for new fathers. And again, there was this overall feeling of feeling silenced or pushed aside, either when trying to advocate for their wives or trying to be included in the processes of what was happening, or being put out of the labor and delivery room and not really being told what was happening. So these are very important perspectives to recognize and to consider. And then lastly, we have the social support from the perspective of midwives, doulas, Black OBs, and doctors. So the benefits of doulas and midwives is the major thing is that they are a very important advocate for the patient, for the mother, because their focus beyond like a medical standpoint is focused on the comfort and the safety and the support of the mother. And so they provide a really beneficial role in a labor and delivery sense, where maybe the nurses and the doctors are focused more on the health of the baby, the health of the mother in a more objective sense, but the midwives and doulas provide more emotional support that I'm not going to say other medical individuals, medical staff won't provide, but they are much more focused on the woman and advocating for her. And they've created birthing plans in the prenatal aspect, and they, in the postnatal care, they can help with contraceptives. They can help by checking in on the mom and like identifying maybe symptoms of postpartum depression, and just being an overall support to them that they can lean on after delivery. And I think that is a very necessary social support. As someone who wants to be a midwife, it's very important for the Black women to have access to that support. And unfortunately, fortunately, mothers are 4 times less likely to have low birth weight babies and are more likely to initiate breastfeeding when they have doulas or midwives. And again, as I mentioned before, representation in healthcare is still very important. And Black people as a whole, but Black women especially, feel safer when they have women or just anyone in medicine that looks like them. And they feel safer and feel like their concerns are going to be heard and feel like they're going to be understood at a better rate or in a better way. And so representation in all aspects of healthcare is very crucial and something that needs to increase over time. And it doesn't necessarily have to be just Black individuals, but more people of color in general in medical spaces. Right, so the next slide just shows my references, which were referred throughout the presentation. And then lastly, I just included some honorable mentions. I didn't get to read these books, but these are ones that I do plan on reading and I would recommend to other people. Plus, the book that I referred to quite frequently was Pregnant While Black by Dr. Monique Rainford. And if you want more information about this, I feel like this is a great place to start. And it definitely goes a lot more in depth. But we also have The Pain Gap, Birthing Justice, which these are the same books, but just 2 different editions, and Weathering, which goes more into detail about what I was talking about earlier. So thank you so much for joining me, and have a great day.